I'm Melissa Kievman. I'm a producer here for the Ignite series for the Brown Arts Institute, and this is the fifth of a series with that the Brown Arts Institute Ignite series has done in partnership with the School of Public Health Pandemic Center. We've been honored to host the Pandemic Center here, and the extraordinary vision they have brought to the table for bringing art and narrative and the most trenchant issues of our moment to the Brown community and beyond. I just want to read the fire speech as required, so bear with me. In the event of a fire alarm, please proceed calmly to a nearby exit, leave the building, and move away from the doorway. Please note the location of nearby exits and that the closest exit may not be where you entered. Be aware that the way you entered may not be the most direct way out. Please don't sit or stand in the aisles and doorways. No smoking, no cell phones, no pagers. And thank you for being here. And join us afterwards for a continuation of our reception. Thank you. Jeff.
Good evening, everyone. Welcome. I'm Jennifer Nuzzo. I'm director of the Pandemic Center at the Brown School of Public Health. I'm really glad that you're here. As Melissa mentioned, this is the fifth screening that we're hosting in the Our Storied Health film and media series. And as always, we are very proud to collaborate with the Brown Arts Institute as part of the inaugural Brown Arts Ignite series, which is Brown Arts' multi-year series of creative activations, interventions, and investigations produced by communities across Brown, Providence, Rhode Island region, and beyond. Through this series, we have been exploring ways that storytelling and narrative can help shape public health communications. Not all of the films are pandemic related, as you can probably tell by the topic of this film. We have been watching these films to learn from them, to learn how they talk about health issues so that we may better communicate about public health issues, including ones that we work on at the Pandemic Center. But tonight's discussion is particularly important, and I've said that at each of our events, so just to put a bit of a note that I always say this, because all of these health issues are really important. But in each of the films that we have seen, as I said, they haven't been specifically chosen because they relate to pandemic-related issues, but in each of them I've been able to learn something about pandemic-related issues, either because it teaches me how to talk about health issues more, it teaches me important lessons about that, or very often I'm able to see a thread that ties to the issues that we work on in the Pandemic Center, where we see what happens when sort of a no-notice health emergency strikes and what that can do to many other aspects of people's lives, including their health more broadly. And that's particularly true about this film as well. And I just wanted to reflect a little bit. In the start of COVID-19, I was part of a group of epidemiologists and other public health scientists who were asked to sign on to an amicus brief that was specifically around the topic of why COVID-19 should not be an excuse to stop offering essential health services, including abortion. That if we were to stop providing essential health services, such as abortion, that would make public health worse. It wouldn't make public health better. And I am really disheartened that we have to continue to talk about that topic, and that is what we're going to be seeing in this film tonight. After this film screening, we will have a really important discussion with some of our Brown faculty and the creators of this film and our filmmaker in residence, Dr. Jen Galvin. So please do stick around for that, and as Melissa said, please do stick around for the reception afterwards so we can keep the conversation going. We know these issues or have a long fuse on them. We really will need to keep working on them for quite a bit. We unfortunately are still talking about them, and we may still have to talk about them in a bit. So I hope we can use tonight not only to gain new tools by learning how to talk about health-related issues using storytelling and narrative, but also to maybe kind of reactivate energies about why these issues are so important. So without further ado, I present the film Zurawski versus Texas.
Thanks, everyone, for being here. Liz, thank you for joining us this evening. And Maisie and Abbie, thanks for making this powerful film and for traveling all the way from Chicago and Marfa to Providence.
Thank you.
Given its sensitive material, this film might be one that some prefer to watch alone in privacy, but I'm reminded tonight of the power of watching this film together because it forces us to look at each other and to talk about it and hopefully meet people who can help with solutions. I also don't take for granted our right to assemble and to share our ideas freely in a place that supports rigorous science. So sincere thanks to the Brown Arts Institute for providing space for this screening and civic engagement. So we're going to have a sort of a panel discussion first, and then I'm going to leave plenty of time for audience participation and the Q&A. But Maisie, we'll start with you. So in the summer of 2022, Roe was overturned, and I remember we were emailing shortly after, and you wrote, quote, "I'm in production on a film about the post-Roe abortion landscape." And I remember reading that email and just thinking, oh my God, thank God Maisie has this, she's on this story, and there was no one's hands that was better suited for a story like this one. Thank you. Take us back to when Roe was overturned. Where were you, and why did you choose to follow the story of a court case versus finding another way into the story like you did with Jackson?
So in 2016, I made Jackson a documentary about the last abortion clinic in Mississippi. When that was the same clinic that was at the heart of the Dobbs case. And so when Roe was overturned, I was at that clinic. And I don't want to say that people weren't shocked, but people were very sad. And we knew already and had anticipated making a film. We had decided to make a film the day of the oral arguments in that case. And the clinic director from Jackson, Mississippi had called me to say, you know, there's no one from our side outside of the Supreme Court. This isn't going well, and the justices, their line of questioning is terrifying. And I think that Roe is going to be overturned. And Abbie and I were sitting together when she made that call, and it was then that we decided to make this film. And so we did a lot of research and traveled multiple places, but really wanted to make this film in our home state of Texas. And that is how we ended up following the lawsuit. And through making Jackson, I had developed a really close relationship with the Center for Reproductive Rights. And so when they had decided to file this lawsuit, we were told about it and decided this was the film and the direction that we wanted to take things.
That's great. Abbie, you're up next. We know that framing everything as a crisis can make people tune out, feeling otherism and apathy. Tell us about how you created a film about a fight for healthcare in Texas that would also be relatable to audiences across America. Can you share some of your narrative decisions when it came to showing the crisis that would help us feel connected to it and inspire a sense of collectivism?
Yeah, I think, Maisie and I, when we started researching, what we saw was a lot of people in crisis, and it was really devastating to witness, and we were grappling with that on the ground, trying to understand, how do you tell a story when it feels like there's so little hope out there. It was a new landscape, and we were figuring it out, but it was really difficult to spend sustained amount of time in, and I'm so glad we had each other to talk through a lot of the narrative decisions we made, because what we knew we needed was hope. And so it was once we were introduced to Amanda and Samantha in Austin and saw Molly at work that we realized, somebody is out there fighting, and this is the story we have to tell, because we need to have leaders and fighters to look to in times like these. And I think now what we're seeing in Texas is that, women are dying because of these laws. And so we remain in this moment of crisis, which it is maybe natural to want to tune out because you feel powerless. And I think that's what some people would like you to do. And so we've been really encouraged showing this film after the election because people are really energized by it. And it's easy to feel the strength of the women in this film and see them fighting back and think, what can I do in the realms that I work in to look for justice?
Yeah. So Liz, here in the Northeast, we talk a lot about states' rights, and we're counting on them holding up. What do we need to know most about policy here in Rhode Island, the impacts of leaving abortion rights to the states, and how worried are you about a national ban?
Yeah, I mean, in Rhode Island, we have pretty progressive laws with regard to abortion access. So we do have access, legal access until viability. Obviously, as we've watched the film, that is not enough. And it's made very, very clear and powerfully in this film that abortion is a decision, a kind of medical care that needs to be decided by the patient with their doctor at any stage of pregnancy. So that's an issue that we need to think about in Rhode Island. We have, in the last couple of years, passed legislation to provide Medicaid coverage for low-income people to access abortion, so that's a huge step forward. We've also passed a SHIELD law, which would protect our healthcare providers should they provide abortions to people coming from out of state, whether from Texas or the many other states that have bans. So those are all good things. There are other laws that other advocates are considering working on this year, including parental consent. We do have a parental consent law that makes it quite restrictive for people who are under the age of 18 to access care in certain circumstances, so that's something that advocates are working on. With regard to state law versus what could potentially happen nationally, it's of course really important to understand that none of our state laws will hold up against a national law, right? Federal law preempts state law, so if we do see any kind of national law, then all the protections that we are providing under state law are not going to be important, or they're going to be important, but they're not going to hold up. I don't know how to predict whether we will see a national law. Of course, President-elect Trump has said he's not in favor of a national ban, but the whole question of what is a ban and what is not a ban really comes down to how a law defines access. So I suspect we will see a national law proposed in Congress, at some gestational period. And I think that we have to be prepared for that and be thinking about what that could mean, both here in Rhode Island and, of course, across the country.
Yeah. Maisie, tell us about facing sensitive material with the camera in your hands. How do you decide what you should be shooting, maybe perhaps when you should turn the camera off? And then once you do capture something, how do you decide maybe where to draw the line with what you include in a film? And maybe that comes in sound or visuals, but talk a little bit about, having the camera in your hands when you're filming these women and following them, whether it's in the court case or at home. Can you talk to us a little bit about that?
So when Abbie and I went into making this film, we talked a lot about continued consent and what that process would look like, because we knew that every one of the stories we were telling, including Molly's, was going to be emotional and painful, and a lot of times people would be consenting in a moment of high stakes, of stress, and we wanted to make sure that people were still okay with that afterwards. So, I think one of the best examples in this film is the funeral, Halo's funeral. And Abbie and I had met Samantha the night before Halo's funeral. And one of the first things we asked is if she was okay with us filming that. We had been introduced to her as documentary filmmakers through the Center for Reproductive Rights. And Samantha immediately said, yes, the state of Texas wanted me to have Halo, and they need to know what that looks like for my family, for Halo, and for my other children. And I think it's very important that you film her funeral. So we filmed her funeral. It was incredibly emotional, obviously for everyone there, but for us as well. It's not very often that I cry behind my camera, and I was doing my best not to just break down sobbing that day. And we had a lot of discussions in the edit on whether or not we would include the visuals of Halo's lifeless body. And it really came down to Samantha making that decision. It was important to Samantha for the world to see what her daughter looked like. So much so that she put an image of her daughter on her gravestone. And so for us, we felt that if that's what Samantha wanted, then that was important for us as well. And I know it can be really hard for people to see, but we think that that is really the point of making this film, for people to understand what each woman is going through when they're denied this care.
Yeah. Do you want to add anything, Abbie?
No, I mean, yes, it's completely, I think this is the most collaborative film that we've made with our film participants. And, you know, another example is when Amanda was going to find out the results of her surrogacy. And, you know, I think we all went into that thinking that it was going to be good news, and we were all feeling excited that she would finally have this new development. And when that did not happen, it was something that we, again, like revisited with Amanda after the fact. And we made it clear from the beginning with all of them that, like, we are happy to turn the cameras off if you need us to. Like, we understand this is ultimately your story to share. And so we did not want to violate that or make it feel unsafe. And so that's really what guided us in all of those decisions, was taking their lead.
And I'll say no one ever asked us to turn off the camera. Molly did a lot because of privileged conversations, but outside of privileged conversations, at intimate, in home settings, like no one ever asked us to stop filming.
So Abbie, give us some wisdom, even if it comes in the form of a warning. What's your message to us here gathered in Rhode Island? What should audience members do next? I know you have your impact campaign with this film. And what are you learning from other audiences across America?
Yeah, this ask comes from Samantha, which is tell one person. I think it's easy to debate this subject on a very abstract level, but to actually share the stories of Samantha or Amanda or Austin really allows you to ground yourself in reality. I know that conversations about abortion can be uncomfortable, but the people in your life are the people that trust you, and so to be able to rely on those relationships to then open the conversation about abortion and talk about what an abortion even is, because I think, you know, it's so much more expansive than people would like to believe a lot of the time. And, you know, through making this film myself, like, I've been able to have conversations with family members who are anti-abortion that are really productive, because it pulls it out of the political realm, which it shouldn't even be there. It's political because it's been politicized, and until we wrest that back and recognize this is a healthcare issue that a doctor and patient should be making a decision about, you know, we're going to be stuck where we are, but right now we need to be talking about this issue as much as possible.
Yeah, that's a really good lead into my next question for Liz. So public health is in a really vulnerable state right now, and we are battling mis and disinformation, and we are losing that battle. This film does an incredible job countering misconceptions about abortion. Help us more expansively understand how abortion impacts our health collectively, and what else do we need to be thinking about? What are the unexpected ripple effects of being denied abortion rights?
Yeah, I mean, I think the beautiful thing about this film is that it absolutely portrays abortion as healthcare. And you know, as you said, it's been so politicized. And the way that the laws have been drafted are in this context that are completely devoid of what they mean for people's real lives. And so I think, you know, as we think about communicating about public health, as we think about communicating about healthcare, as we think about communicating about law, it has to be grounded in stories. I think it's the only way that we can really get to the root of why the way we write laws, the way we conceive of laws, the way that we frame problems or issues ultimately affects people and people's health. And so I think I'm hopeful in the sense that I think, you know, what a film like this does and what this conversation, these kinds of conversations can do is help us to move into a whole new conversation about what abortion is, as you have done so well. And we have not, since Roe, been able to have those conversations. So as bad as things are, I think there is a hopeful sign that we might actually move to a different place when we get there, of being able to talk about healthcare for women and what it means to have access to all kinds of healthcare. And I think that's a messaging, that's a message for public health in general, which is how can we tell stories in a way that get at sort of what the critical issues are around people's health, and how do we think about law and policy and discussion and rhetoric in a way that's helpful instead of harmful to that.
Maisie, tell us about the stakes you feel when you're putting a film like this out into the world. I mean, do you ever worry putting the film out? Do you feel safe putting the film out? What are the stakes for you personally? Maybe Abbie, you can chime in too. And is the conversation around the film different now that it's post-election?
Yeah, for us in putting this film out, it was, we felt it was paramount to get it out before the election. I don't think we were foolish enough to think that we could have an impact on the outcome of the election, but we certainly felt a sense of responsibility in ensuring that people had access to these stories and to understanding what denying abortion actually looks like in reality, and what a national abortion ban could look like across the country. This is Texas, but it's also, I think, 13 other states right now, and it could quickly become a national abortion ban if we're not careful. So I would say those were the stakes. I mean, we made this film very fast. We spent a lot of time in the research phase, and when they filed this lawsuit, it was March 2023, and we premiered this film in August 2024. So that's a pretty quick turnaround for a documentary, and we knew that that was our deadline going in. And I think that the film it's different post-election, because I think that in places where people felt like, okay, this is a Texas issue, this isn't my issue, like, oh, look what's happening in Texas, I think now people look at this film and hopefully recognize that it could also be on their doorstep, that it could be their own experience, their friend's experience, their daughter's experience, their mother's experience. I mean, I think it really at this point affects all of us, and I think it's important for people to understand that.
Abbie, is there anything missing from the film that you wish you could have included when it comes to the story of abortion as healthcare? Is there anything that you wish you could have included, or if you were going to follow another story now? I mean, is there anything that's missing from the topic for you?
I think one of the wild things about making this film is that we used footage from almost every shoot we did because we had so little time. I mean, we shot what we needed and we made it. And so I don't feel like we left anything on the table because we really went for it. I don't know if you would agree with that, but.
No, I mean, I think for me it's important that people know that Abbie and I feel like there's a spectrum of reasons that people access abortion care. And we believe every abortion is an abortion that someone should be able to get. But in making this film, we felt like if the stories in this film and the women in this film weren't able to access abortion care, then no one else was accessing abortion care. And so that's why it was critical to us to start there. Mm-hmm. And so I think, if we had all of the screen time in the world, we would tell the wide, variety of stories in terms of both how hard it is to access care and, all the different myriad of reasons that people might seek and need abortion care. And so I would say, if anything, that's what was left out, but we felt like it was critical to focus on one tight narrative for this film.
Liz, what else aren't we thinking about in terms of the impacts of American reproductive health care policy? You know, should we be thinking more about how it impacts education, employment, you know, where people are deciding to go to college, or perhaps even more widely, how U.S. policy influences global health and sets the tone for international norms around abortion care? I don't know what direction you'd want to go, but just help us think more widely in that way.
Yeah, I mean, I think in terms of U.S. effects, there's really good research showing economic effects for women of not having access to reproductive health care, including abortion. So, you know, and of course we know in the states that have banned abortion or have heavy restrictions that the people that are most impacted are going to be lower income women and predominantly women of color who often don't have access to, as was, you know, shown in the film, to be able to leave the state and to access the care that they need. So, you know, all of this is exacerbating existing economic disparities that are already present across the country, and also particularly in some of the states. I mean, Texas has really horrific health disparities already. They have the least coverage of insurance for women of any state in the country. They have really bad outcomes for infants and maternal health, right? So we know that all of those things are closely tied together. So you know, the impact of that is significant. Another aspect of this is, and this is work I've been doing, is looking at the impact of access to reproductive health care and issues like intimate partner violence. And we also know that when people don't have access to abortion care in particular, they're less likely to be able to escape abusive relationships. We know that reproductive coercion, where a woman doesn't have control over making decisions about birth control, that we've seen that escalate. The numbers have escalated since Dobbs, because apparently it's sending a signal that women shouldn't or don't have control over their bodies, right? So there's a whole, I think, array of issues that unfortunately come with not allowing people to access reproductive health care. In terms of the international environment, it's not my expertise, but I do know that, you know, we as we are retracting rights, other countries are expanding them, including countries like Mexico and Ireland that have long had bans on abortion access. And in those countries, you know, their courts have looked to their constitutions and recognized rights and have expanded access. So in 2024, we're retracting rights that other countries that are expanding. And so I think, you know, it's pretty clear that we're signaling as a country a retraction of human rights, of rights that most international human rights organizations, including places like, or organizations like the WHO, would say, these are basic human rights. And, you know, I think that's not only terrible, obviously, for people in the US, but also the signaling across the world about what we value and what we don't value. And, you know, to those countries that have looked to us for democratic principles, it's sending a pretty terrible message.
Have you shown this film in like Dallas or Houston or like other places in Texas?
We've shown it across Texas.
What's that?
Yes, we've shown it across Texas.
So what's the reception there like, especially outside like the big cities?
At all of the Texas screenings I've been at, they've been packed. And people have cried, people have laughed, people have gone through the same range of emotions that people across the country go through. And I think people in Texas are pissed. The majority of Texans do not believe abortion should be banned. And I was at one screening where the lawyer representing the state of Texas in Kate Cox's abortion case actually came to the screening. And he left in a huff during the credits. But I think time and again, you know, there's very few people I've interacted with at screenings or otherwise, you know, and I'm a lifelong Texan, that think abortion should be banned in our state.
Yeah, you just kind of wonder why you know, the judges or like the Supreme Court judges were so like opinionated.
We elect our Supreme Court judges in Texas, and there was a campaign to unseat 3 of them who were up for re-election. They did not get unseated, unfortunately. The Houston Chronicle, one of the biggest newspapers in the state, actually endorsed the 3 Republican judges, saying that they should not be unseated just for the way that they ruled on abortion, unfortunately. And, you know, I don't know what the answer is other than people voting. And, you know, I guess we saw how that went on November 7th. So I guess I'm just as frustrated as everyone else.
Thanks.
We specifically followed the women in this lawsuit and the 3 women who testified in this case. And I do think that Abbie and I will continue to look at making another film as abortion changes in this country. And I think, sadly, there were many women in Texas who were denied the care that they deserved that couldn't be a part of the lawsuit because, as is briefly mentioned in the film, I mean, joining a lawsuit like this is just as challenging and difficult for someone who has the same disadvantages of those who are unable to leave the state for to get an abortion. And so the makeup of the case was predominantly white. And I think that's when you look at the criticisms around the case, that has been one of the main criticisms. And so, yeah, I think those are very important stories. And whether it's us telling those stories or someone else, I think it's really important that those stories are told.
Thank you, because those are the women that are dying and they're most publicized.
There's a really great documentary called Aftershock. If you haven't seen it, I highly recommend it.
Great film. Thank you for putting this out. I think one of the scenes that was poignant to me was the medical board that they went in front of. Having worked with medical boards, you're kind of like, hello, you know, anyone in there? So loved that you showed that scene. Were you hoping going into it that there would have been more from them on it? Or did you sort of know going into it that they were going to just flip-flop it back?
The medical board is appointed by the governor's office. So going in, we were fairly certain that it would kind of go this direction. Yeah, I just remember being as frustrated as Amanda and Josh were that day. And it went round and round for like 6 hours. And there were so many people there that were speaking on behalf of individuals denied abortion care. There were doctors. So many people spoke. And the anti-abortion movement had just a small handful of people. And they still didn't do anything to make it better.
Hi. First, I want to say it was a extremely impactful and well-done film, so thanks so much for doing that. I wanted to ask if it would be available like publicly for streaming or is already available. I'd love to share it with people.
So we will be releasing it for streaming in January.
Yeah, you can check out our website, zurawskivtexas.com, for all of our latest updates. We have more screenings like this and at festivals and impact screenings across the country, but then it will be available online in January. So we'll announce the dates of that soon.
And the platform that it'll be on. We just can't publicly announce it yet.
And there is on the website a host your own screening, so maybe there's somebody here that wants to host another screening, and you can sign up to do that on the website.
I guess I'm just wondering whether they have been victimized by hate language or have been attacked for their positions.
I would say the majority of messages the participants in this film and the plaintiffs in the lawsuit have received have been supportive, like overwhelmingly supportive. Of course, there's the same trolls that would message anyone in this situation, but nothing, I think, of legitimate concern. They've had, I mean, they're like, Amanda at this point, I feel like, she's like recognized on the street, and people come up and thank her for the work that she's doing. She joined the Harris-Walz campaign as an official surrogate during the campaign, and so spoke a lot across the country about her experience, and I never really got a lot of blowback.
Thank you so much, really, for the film and the discussion. As I mentioned in the opening remarks, this is our 5th screening of a film. We've covered a range of different topics, and I've been sort of reflecting back on all of them and what the lessons that I could kind of pull out from these films are in terms of how we talk about and try to motivate action on the issues that we care about in public health. And, you know, I have a few lessons, and some of them you think are really well captured by your film. One you've already spoken about, which is the importance of sort of taking a abstract sort of policy issue that gets turned into political rancor and sort of showing the human side of that, showing what it means for real everyday Americans and their health and their families' well-being, and just really the very personal individual stake. So it's taking a public health, population-level issue and shining a light on what it means for individuals. I think that's really important. But another lesson I have taken from across all the films, which is that there is so much heaviness in public health, so much struggle, so much fear, so much badness that we have to overcome, that when we have moments of optimism or moments of hope, that kind of pulls us out of maybe the fetal position, oh, this issue's too big, it's just too depressing, it's too horrible, I can't do anything about it, but to think about, yes, we can actually do something about it. And in this political moment right now, that I think particularly resonates, where a lot of people feel really tired and exhausted, and they don't know what more can be done. And I know you talked about a little bit the impact, but I'm wondering if we could talk a little bit more about kind of like, what do we do now and how do we move forward at a moment when we might feel, above all, not really like doing much because it all feels so hopeless.
I mean, I think to build off of what Abbie said, it's about having conversations. And I think having conversations with both those closest to you, but also unexpected conversations. And, you know, I've said this in Texas, where I think it probably matters more than here, is that, like, I talk about abortion every day to, like, I don't know, like probably 10 or 15 times a day, a lot of times to strangers. And in Texas, like, no one's ever bitten my head off. Like, for the most part, it's been a very civil conversation. And I've found that I can work abortion into any conversation. And I think that's really important right now in a time when people in at least 14 states are being denied care, to just talk about it and normalize it and make sure that it doesn't get to the point in other states that it is in Texas. And I think that's incumbent upon all of us. And I think that if people don't want the rest of the country to be like Texas, they need to be calling their elected officials and making sure that they know how the people they're representing feel. I don't know if you have anything to add.
Well, I'm curious what you think people should do, because I feel like you have an awareness of the broader landscape that might be,
Yeah, I mean, I'm not sure I have any the answer, certainly, but I think one of the things that was really powerful in the film, and this is how I often think about, what do we do now, advocacy, sort of what's our role, is the kind of collaboration among, the lawyer, Molly, and the clinician who also had this personal story, and the people that, that were serving as plaintiffs. And I think the worst thing we can do is feel isolated and sort of feel like it's so overwhelming, these issues are so big, what can I possibly as one person do? And we have to find our people, right? We have to find the people that care about the same issue and feel committed to working together across. I do a lot of work with clinicians and with public health people. I'm a lawyer, right? So how do we think about who are the people that might have different expertise, different experience, but have the same passion? And find those people and work together on whatever it is. And it may be, we're not going to change tomorrow, Dobbs, right? That's not going to change tomorrow. But what can we do in Rhode Island to make sure that people have the access they should have, right? Even though we have relatively good laws here, there are lots of people in Rhode Island who don't access reproductive health care, and we know that, right? So we can all find our place. And some people are going to do huge lawsuits, right? And some people are going to work as clinicians and provide the best care that they can, and then find your partners in the community around what are the ways that you can make change. And I've seen a lot of great examples of that here in this state. I'm sure that's happening in Texas. And I think we lose sight of that when we get so beaten down by the stories, constantly telling us how bad things are. I know even in Texas, there's like these phenomenal groups in like far west Texas, right, that are working on ensuring that people can get the care that they need. And we don't hear that. And so we can't get beaten down, and we have to find our people and find our partners, I think is the way I think about it.
Are there any organizations that you can shine a light on that we should be paying attention to that really are kind of, on the front lines, and that we can help them shore up some guardrails?
Yeah, so Jocelyn Foy, who asked the question up there, is with the Women Project, and they're doing amazing, amazing work in the community here. There's phenomenal people from Planned Parenthood. We have an abortion fund, which is helping to support people who need support to get abortions. There's a reproductive justice collaborative here at Brown, which is a collaborative of faculty, students, and other people on campus that are working around reproductive justice. So there are plenty of ways to connect. I think that's the important message, is to find your place and to connect with the people that are doing good work.
Can I ask a follow-up question, which is, what's next for pregnant people in Texas? Is there any pathway, any gathering momentum, anything?
I mean, not to mince words, it's dire in Texas, and women are continuing to face extreme trauma, harm, and death at the hands of these laws. And so the Center for Reproductive Rights is continuing to look for ways to work in Texas. They have not given up on Texas, as many people might want to. And so they are looking for ways to defend reproductive health in whatever means are possible. And then there are great people working on the ground. Just to tag on to what you were saying, there are abortion funds across this country who work locally, who know their communities very intimately and know where the need is, and the need is great right now, and the funding is not. And so supporting your local abortion fund is a great way to immediately plug in on an issue like this.
And I also think just spreading the word about local abortion funds is really important, because I think we've met a number of people who didn't know about their local abortion funds, who ended up not leaving their state because they couldn't afford it, and they didn't realize that there were abortion funds out there that could help them. And so, again, in my goal of talking to as many people as possible about abortion, one of the things I try and always talk about is my local abortion fund, so that every person I know knows about it. And I think it's important that we continue to do that.
Hi, so I'm on the board of the Rhode Island Abortion Fund. Hi, Jean, I didn't see you walk in either. So just to echo all of that, so we're here. We have new merch. But no, it really is so important. We actually just went through a name change. We were the Women's Health and Education Fund, which people didn't know what it was. People didn't know what we did. So now we are the Rhode Island Abortion Fund, to say it loudly and proudly and clearly what we do and what we can provide for Rhode Islanders. So also next steps are donate. Thank you for bringing that up. Donate to your abortion fund, because all of our funds go directly to the people who need them for abortion and contraceptive care. As Liz spoke to, we are relatively protected in this state, so donate to other funds as well in other states. But yeah, money really goes a long way for people who need to access care and literally can't afford it. So we have materials outside, so please come grab some of those in our new merch. And we also have a fundraiser coming up next Wednesday at Flatbread. So join us for local art, free pizza, and to raise money for abortion care. But thank you all so much for the film, too. It was great.
Just kind of by chance, like about 3 months ago, I was in the Hamptons for the Hamptons Film Festival, and I was just looking through the movies to see, and I guess this was playing over there. I didn't see it, but I noticed that Chelsea Clinton was speaking afterwards, and I guess Hillary is involved in this, and I guess since I live here, so I guess since it was playing again, I came to see it. But can you talk about Hillary and Chelsea Clinton, their involvement in the film?
So the film was made by 3 production companies. Our production company out of nowhere, another production company called Storyforce, and then Hidden Light. And Hidden Light is Hillary and Chelsea Clinton's production company. On the day that Roe was overturned, all 3 production companies had been speaking and talking about the idea of doing a film, but we formalized that arrangement the day that Roe was overturned and worked together. And so we did not, Hillary and Chelsea aren't like in the editing room, but they really worked tirelessly on promoting this film, and they've done a number of panels and discussions following the film, and their production company has an incredible team of executives that worked with us on this film. So they were very involved through those different avenues.
Thanks.
I just have one more question, something to leave us with. Is there a shot or a line from the film that just is always with you, that you want us to remember?
Well, I always think of Amanda's last line in the film, and that's really how I think about this film, and how I hope people leave this film, is that, like, even though there are these moments of defeat, that there are still so many people out there fighting, and that if you believe abortion should be accessible, then you need to fight too. And that's always been my biggest takeaway.
Abbie? No?
I think that's a great one.
Yeah. Great.
Thank you.
So thank you, everyone, for coming and watching this together, and thank you to our amazing panel. I'd like to thank the Brown Arts Institute and the Arts Ignite series, especially Melissa Kievman and Owen Carson. Thank you also to the Pandemic Center, Bentley Holt, Alice Im, Leah Lovegren, Andrea Ulig, and Michael Mitchell. There's a survey where you can give feedback on tonight's screening through the QR code displayed. Please spread the word about this film. I know you all can do that. Visit the film's website and sign up to host a screening if you can. And there are drinks out in the lobby, and I think some dessert. So I hope you'll stay and talk more about the film and raise a glass to these 2 incredible filmmakers.
Thank you.